So in order to help with the diagnosis of acute leukemia, there are some major laboratory tests that need to be performed, such as the peripheral blood smear, the full blood count, and the bone marrow samples. So in the first one, the peripheral blood smear is a test where a sample of blood is examined under the microscope, and it can be checked the number, size, and shape of white blood cells. It looks for immature white blood cells, which are called cell blasts, and it enables to differentiate between the different types of acute leukemia, AML and ALL. For AML, the blasts are actually myeloblasts and they appear very large cells. For ALL, the blasts are called lymphoblasts and they appear very small cells. For the full blood count, FBC, people with AML can have really high white cell blood counts due to excessive amounts of myeloblasts in the blood. These cells don't work properly as they should. They also appear to have low blood platelet counts and low red blood cell counts. Typically, a healthy person has a white blood cell count of around 4,000 and 11,000 cells per microliter, but in around 50 to 60% of patients diagnosed with leukemia show to have around 100,000 and 400,000 cells per microliter. In the last test, the bone marrow sample test, it's actually a very important one because leukemia actually starts in the bone marrow. So checking the bone marrow for leukemia cells is a key part of testing in order to confirm this diagnosis. So this test is a pathologic analysis of samples of bone marrow, and it's obtained by bone marrow biopsy, which is also called three-frame biopsy, and bone marrow aspiration. So bone marrow examination is used for several conditions, and acute leukemia is actually one of them.
A common diagnostic tool used to diagnose leukemia is immunophenotyping, and it's a type of a flow cytometer such as this. The way in which this works is cells are suspended into the flow cytometer, and sometimes they're marked with fluorescent lights, which are used as a marker. And most of the cells at the bottom are traveling in a linear format due to a fluid called the sheet fluid, and the major part of this method involves a laser beam that is aimed at the linear cells and creating different types of scattered light. One is forward scatter, which is used for counting cell volume, and a side scatter that is more for understanding the complexity of the interior of the different cells. And for example, the size of the nucleus or the amount and type of cytoplasmic granule, or just the type of roughness of the membrane that the cell has. These are all converted into quantitative data to understand what type of cells are present in the patient and what diagnosis is best. And due to these abilities, it's able to differentiate between the different lineages of the cells and the type of leukemia that the patient might have. These are all considered along with the past history of the patient.
So I'm just going to talk about the advantages and disadvantages of the immunophenotyping method. As already mentioned, the procedure allows efficient identification and helps to distinguish between varieties of cell lineages, and further helps in analysis of leukemic bloods. But the disadvantage is that the person using the technology or equipment for immunophenotyping needs at least 1 week experience using it, and before analysis of a leukemia specimen, a healthy individual sample should be tested first. Also, before processing the sample, it may be stored in a room at room temperature or at 4 degrees. And if the specimen is stored for over 24 hours, additional tests for viability is required, and maybe additional tests for medium is required. So this may delay the process of diagnosis.